Patient case study number 16. This talks about a male who is 22 years of age. It goes through, he comes in, he starts complaining about back pain around his abdomen on the right side. You guys are going to read the rest of his little scenario, put it into your own words, and put it on the bottom of your report. As we go through and we start looking at patient number 16, some of the things that we're looking at here. First off, his sample of urine. And his sample of urine in the test tube is going to look like this. I'm trying to give you guys a little clear view here. So that's that sample for patient number 16. You want to mark down your color. Try to be as exact as possible. And the second thing you guys want to look at is turbidity or clarity of it. Clarity meaning, can you see through it? Is it clear? Or turbidity, is it turbid? Is it have chunkiness in it? Is it a little cloudy? Is it harder to see through? Is there solutes that are making it hard for that to happen? So clarity as well as color for that first part that you guys have here. The next part that we want to look at is the bottom here, and that's looking at your pH. So the first strip that you guys are going to see on this side is your normal pH paper, p-hydrin paper, which means that it runs 0 to 14. I'm trying to blow it up a little bit for you guys so that you guys can see these particular numbers a little bit easier. So it goes 0 to 14. Remember that anything lower than 7 is slightly acidic. The farther you go away from 7, the more and more acidic it becomes. So I'm going to take a drop of patient number 16, that particular urine. I'm going to put it down so that you guys can record the pH that you think it is. So try to match that color up with one of the colors that you see on this wheel. Mark it down. It's not going to be very specific because they're whole numbers there. My second type of p-hydrin paper, next to it goes 5.5 to 8, so it's going to be a little bit more exact for you. Doing the same thing with that strip of paper and matching it up with that particular color wheel that you guys see there. So give me those two particular pHs, best that you can on those two. The next test we're going to be looking at is your glucose test. So my top sample that you guys see here, that is Mr. Rollins's glucose. So remember, that's urine with the Benedict solution in it, and Benedict's tests for sugars when added to heat. So these have already been on heat, they've been pulled, and that is Mr. Rollins' urine right there, testing for sugars. This is test patient number 16, looking for sugars. So remember, Rollins was our control patient, everything is normal on him. Next test that we have proteins and we have chlorides. So the top row that you have is Mr. Rollins. So here and here are Rollins's tests. Your patient 16 is here and here. Protein was our burette solution added to it. So they look kind of the same there. So mark your proteins, whether you think he has them or not. Your chlorides test. Rollins is clear up here. You're going to notice patient number 16. He has kind of this milky substance in it. With chlorides, if it is positive, you will get a white precipitate that forms, and there's actually kind of a chunkiness in the bottom of that. Okay, so the only other thing that you guys have left is to go through and look at microscopic view on the computer and come up with your analysis of what you believe patient number 16 has.